Hi, I'm Jerry Calloway. I'm an internal medicine specialist and addiction medicine specialist. I was asked to speak to you about CBD. Unfortunately, we don't have all the information yet. What is emerging is that while it may be useful, we're concerned about what the possible side effects are going to be. The data that has emerged is that it's not pure CBD, that all of the samples that have been assayed that are on the market that we've been able to get our hands on in the medical profession have THC as well. It was purported to be a pure agent, and it isn't. We know what the complications are with THC. We know how it attacks the brain. We know how it attacks the liver, and that's what we're going to have to be studying with CBD. I personally wouldn't want to be in the control group of people taking it to see what happens to them. Liver damage is silent and cumulative. I think it's going to take studies such as GGTs, a specialized blood test, and ultrasounds of the liver in someone who's been on it chronically to get an idea of what the toxicity is. Because the liver runs everything. It is not an organ you want to damage. All cancers are increased tenfold by damaging the liver. I'm not afraid of dying, to be really honest with you. I had cancer 20 years ago. The thing that I'm terrified of is having a stroke. We do not understand, but people that develop liver damage either from alcohol or marijuana or prescription drugs have a tenfold increase in stroke. I'm more frightened of that than dying, ending up in a convalescent hospital somewhere. So the answers aren't in, and it's being prescribed for pain. It was recommended for me. I underwent major surgeries last year, and I opted not to take it. I've found other ways to deal with pain, to get my own natural endorphins up, because I don't want to add to the liver damage that I did from just a little bit of drinking I did 40 years ago. The damage, some of it is permanent. We're concerned about whether or not it's going to have cognitive effects also, and I think we should watch the medical literature over the next 3 to 12 months to get an idea of what's happening to people that are on CBD. But I would caution people that you may be in a control group to see what happens. We've had things emerge even after we've done careful clinical trials with other medications. We've seen things emerge even after years of use of those. And those are people that have been studied intensively in phase 1, 2, and 3 human clinical trials. CBD may be a useful drug, but like all biologics, the amount varies. That was a problem we had in medicine years ago when we didn't have heart medicines like digoxin. Instead, we had compressed tablets of the leaf, and the patients would either get too little or too much. And that's the problem with biologic agents. I've seen auto accidents in people that were using marijuana because the concentration they used was higher than what they'd used previously. It's a drug that I would just advise being really careful until more information is known. Thank you.